My name is Leah Malegano, and this is Zodiac Exclusive. Today, I am talking to Dr. Jonathan Ngoma, Hospital Director for Kamuzu Central Hospital. He is the man who was at the center of managing COVID-19 cases at the facility. Most of those who have interacted with him, they do think he is open-minded and open-hearted. Dr. Jonathan Ngoma, welcome to Exclusive Interview.
Thank you very much.
It should be a very hectic work running a huge medical referral facility like Kamuzu Central Hospital, Doc.
Yes, it is indeed a mammoth task.
What does it entail, like as a hospital director? What is your job?
Okay, so my job basically is to see that the systems in the hospital are functional at all times. Yes.
What else?
So basically, the services that we provide as a hospital. So basically, we provide 5 services. First of all, is service provision to the people within our catchment and outside our catchment area. Secondly, we're supposed to act as a platform for training of health workers at both pre-service and postgraduate level. We're supposed to conduct research. As you know, we're unique people. As a unique people, we need also information on ourselves. We're also supposed to provide supportive supervision to the people that refer patients to us, that like the 9 districts of the Central Region. We're supposed to provide.
So you cover 9 districts as
yes,
Kamuzu
Central Hospital covers 9 districts of Central Region, which is not a small thing, because the Central Region on its own consists of 43% of the Malawian population. So which was basically close to half the catchment area is KCH. But also, as you know, Malawi stays in Lilongwe. That's the capital city. So the mammoth, it's a mammoth task. But also, when you look at Lilongwe as a district, it constitutes 15% of the Malawian population. And the north constitutes 13%. So which means Lilongwe as a district refers to KCH as its central hospital, as its district hospital. As you know, Lilongwe doesn't have a district hospital. So the district hospital is basically Kamuzu Central Hospital. So you can just imagine the work that is there, which in essence, at the end of the day, when you look at the northern region with almost 6 district hospitals against no district hospital for Lilongwe, which means this is like a district hospital, everybody converges here. So we're supposed to go and supervise them. And finally, we're supposed to conduct international collaborations with other institutions. As a product of the international collaboration, that's why you see that the Lilongwe Institute of Orthopedics and Neurosurgery, that is a baby of international relations. So in essence, we're supposed to do all that. Right? And when you look at the provision of services, we provide all range of services at this hospital, except the super specialized services.
Maybe
which
just breaking down the services that you are offering here as a hospital.
Okay,
Can you just break them down?
So basically, in medicine, we divide them into 4 major disciplines. Medicine, internal medicine, we're looking at disease of an adult person. You have got pediatrics, the concerning of children, surgery, you're looking at operating the patients, and obstetrics and gynecology, diseases affecting ladies, women. But these 4 subdivisions also have some subdivisions. For example, in surgery, you will have orthopedics to do with the bones, urology to do with the urinary tract system. We have neurosurgery to do with the operations of the brain. You have general surgery to do with the general aspect of it. We've got plastic surgery. We have ENT, ear, nose, and throat, plus other subspecialties. The same thing goes with internal medicine. You are looking at nephrology, where you're looking at the kidneys, you're looking at the heart, you're looking at the liver, you're looking at the brain, you're looking at the whatever is in the abdomen, you're looking at rheumatology, where you're looking at diseases of the bones and the tissues. The same goes with the pediatrics. There are also those subspecialties. In addition to that, we have also dentistry around, we've got physiotherapy around, we've got prosthetics and orthotics, where you are looking at somebody maybe has had a limb amputated, but you're having artificial limbs. So we provide everything, so radiology, diagnostics, because for us to know the diseases somebody has, we need to investigate. So we've got the diagnostics, we've got radiology, we have chemical pathology, we have anatomical pathology, among others.
Quite a lot of services
Quite
that
a
you
lot
are
of
providing.
services, yes.
Maybe on average, how many admissions do you have a day?
So Kamuzu Hospital usually has between 1,000 to 1,200 patients admitted every day. And outpatients, we usually have more than 2,000 coming in and going out.
What is the common ailment that you deal with at this facility?
Okay, so this facility we cannot really just say this is the common ailment. We deal with many illnesses. For example, when you look at children, mostly it's malaria, respiratory infections, diarrheas, and for your information, where we used to have a lot of infectious diseases, especially in adults, but with the epidemiologic transition, we're having a lot of non-communicable diseases, diabetes mellitus, hypertension, high blood pressure, chronic lung diseases, cancers. There's so much coming with these diseases also present with their complications.
So I wanted to learn from you or to appreciate, maybe there are some wards that are full every day. Do you have specific wards that those wards are full every day?
So all the wards here are full all the time. Because what you notice is this hospital was opened in 1977. It has remained like that. And what you notice is what were meant to be verandas. We closed them, put windows, made them into wards, and they are all full. So one of the challenges that we have here is space. You remember, we decided to open the orthopedic ward at Lion. It's already full. Because one, the other big thing that we have problem is the motorcycle and bicycle accidents. They're presenting a very big strain on our system. Plus also, you will notice that there is a big epidemic also of alcoholism. People drink a lot, where they get complications of alcohol, among others.
I remember there was a time you did complain about the issue of motorcycle accidents. Are you still reporting such?
It's the same. It's still the same problem that we have. We're having more and more car vehicles. The same streets, they are few, but also as cheap means of transport. The cabazas, where people don't have helmets, where the people who drive these motorcycles and cabazas, the bicycles, don't know the highway code. They don't know the rules of the road. They think they have a right. They think they are entitled to the road. Right? And because of that, that's why we're always having them. And for example, when somebody falls down, it's either you break your head, you break your bones, you can even rupture your intestinal organs. So all those are complications which we deal with, starting from the dentist department, the orthopedics department, the general surgery. Yes.
As a Kamuzu Central Hospital director, are there things that you see within the hospital that we people out there, we don't see, or we take them for granted?
Okay, so first of all, I would like to say that people always say the health system is dysfunctional. The health system is not dysfunctional. The health system is doing a lot at all levels. up to the Central Hospital, where we're managing a lot of patients, all the patients that I talked about here. The majority of them, they come, and a lot of them, you might even think that they won't make it, but they make it. So the majority of patients that they come here, they get healed. But also, people always talk negatively. We're able, as a system, to provide a lot of basic and necessary medicines. We're able to feed the patients that we have here, the 1,200, 3 times a day. We're able to feed them. We're able to make diagnosis for them.
Like on daily basis,
yes,
you feed
every day.
every patient, 3 times a day.
3 times a day.
How frustrated are you seeing people saying all that, and here you are experiencing something different from what people see out there?
Yes, so basically those people, they're entitled to their opinions, but in reality, because it is people, when they've got patience and they see what happens here, who appreciates. But all in all, we will soldier on. I'm happy that we've got a very dedicated health workforce, which is usually working above their means, taking most of their time and getting out of their way.
Quite unique. We have seen you at times releasing some public statements,
yes,
like a concern from the
yes,
hospital on some of the issues that are happening out there. For instance, when there was fuel scarcity
yes,
out there, we saw you as Kamuzu Central Hospital issuing a statement on that issue, as well as you made also an observation on rising deaths and injuries due to motorbike,
yes,
like you have said, and you're saying that it is still continuing. Maybe what motivates you, or maybe why do you such things as Kamuzu Central Hospital?
So for us, when I make that release, it's not me who makes that release. It is Kamuzu Central Hospital, the team that is here at Kamuzu Central Hospital. So why they make that is because of the love they have for Malawians. So first of all, most of those issues we talk about are preventable. For example, when there was fuel scarcity, people got bent. They got bent because they were keeping fuel in their houses, selling the fuel, which was very, very avoidable, because we lose life. Because to us, when we lose a life, we were very touched. Right? And actually you find that some of them are breadwinners, they live orphans, a lot of people suffer. Right? For example, you yourself, behind you there's a village, maybe 2 villages, even more villages, which people now at the end of the day, they suffer like that. The same with the motorcycle accidents. It's like those things are avoidable, because what we there are things which are unavoidable. For example, calamities which are unavoidable, some sicknesses which will come unavoidable. Those ones you accept. But those things which are avoidable, because to us, that's the reason that no, these things are avoidable. So it's more like we have a job to tell people what we see, and then some mitigating factors to say this can be prevented. That's what actually motivates us. So basically, if when we don't love these people, we just say, okay, that's their own problem, right?
Apart from the love that you have for the people, was it having any impact on
yes,
your service provision
yes,
here at the hospital?
So we found that after we had said that, the numbers go down, because there was another time where there were some taxi drivers who were being made drunk and their cars being stolen. So we made that publicity, and we saw that stopping. So in essence, what is important? So we believe that you cannot talk about treatment without preventing. You know, by preventing, you are treating. By treating, you are preventing. So these cannot go unchecked. They have to go together. Yeah.
Apart from the impact that those statements coming from Kamuzu Central Hospital made out there, I wanted also to understand, was it having an impact in terms of service provision, as you already have a lot of people that you're serving as Kamuzu Central Hospital?
So yes. So for example, somebody who has been bent, right? For example, somebody who has been bent 95% of the body. So you need gauze to cover the body, the Vaseline gauze. That's a lot. It is very expensive. So already this is a system which has where the demand is greater than the ability to provide services. And then on top of that, we are adding unnecessary things which are avoidable. So yes, service delivery is affected because in everything you see the Kabaza patients. One, they occupy the space in the hospital. They occupy our food. They occupy our water. They use our water. It's a lot. But on the other hand, they themselves are affected. Because, for example, you are injured and have to stay in the hospital for 6 months. Right? So if one is sick, two people are rendered useless because somebody has to be a guardian, somebody has to be a patient. So at the end of the day, there's a lot of loss in terms of economic activity. So it's both on the patient, it's both on the health system. Yeah.
Maybe on the issue of fuel, before we proceed with our conversation,
yes,
the fuel scarcity, did it had any impact on the hospital?
Not really, because we have been very privileged because most of the vehicles we use have been diesel. So diesel has not been very much affected, but also we're also happy that the filling stations we usually go to recognizes that we're a big customer. So when they have fuel, they were prioritizing us, but also even the Malawians themselves, when fuel comes, they see an ambulance, they give it priority to be fueled. So I would like to thank the Malawians as well. I would like to thank the fuel, the filling station owners, because to them they say, no, this is our customer, because we go to them all the time. Right? So when there's a problem, they give us priority as well. Yeah.
What do you consider as major challenges at this referral hospital?
Well, there are a lot of challenges. So there's none which I can say is a major challenge. So basically, as I said, the demand for services outweighs our ability to provide those services. So I've got the challenge of staff. Right? As you can see, we have this huge catchment area. Plus also we have a challenge of the drugs, right? Because now, as you can see, that the hospital is not the way it was 20 years ago, because now we've got more specialists, and each specialist has got its own requirements, and most specialist drugs, they're very expensive. We talk about cancer, we talk about cardiac, we talk about orthopedics. So I usually have problems with that. We also have problems with the diagnostics, where maybe the machines are not working, they're broken down, we don't have reagents, and for us, for example, to be able to do the tests on each and everyone who comes. So our big problem is usually the numbers that we save. Yeah.
On the issue of medical personnel, maybe how many do you have at Kamuzu Central Hospital?
Well, we have numbers, but they don't match with the work. We have over 600 nurses, over 30 medical specialists, about 100 medical doctors, over 100 clinical officers. So we have the people, but they're not enough. I think that's the message.
Maybe in terms of statistics, how do you put like one nurse out of how many patients?
Okay,
maybe on average?
So ideally, we're supposed to, in the general wards, it's supposed to be one nurse against 10 patients. In the high dependency unit, which is just after the ICU, it's supposed to be 1 to 2. For the ICU, it's supposed to be 1 to 1. Which now becomes a challenge.
And what is the current situation?
So you find you have a ward where there are 80 patients and there are 2 nurses. So the challenge now becomes that will they be able to monitor the patients, to check the blood pressure, to check the temperature, to check the glucose, and even give the medicine? It becomes a challenge. So now the majority of the work is just left in the hands of the guardians, who most of the times when they come, they tell, can you please come and see? That means the patient is dead. Yes, those are the challenges.
Maybe on the issue of drugs, you also mentioned drugs as one of the challenges that you are facing here. We understand that there are some hospitals who did utilize the whole budget that they were given within 6 months. How is it the case with Kamuzu Central Hospital?
For KCH, we're still within our budget. Yeah, we're still within the budget.
I wanted to understand from you, or to learn from you, Dr. Ngoma. Was there ever a time that you lost a patient and thought of if ABC was there, we couldn't have lose this patient?
There are several times, yes. So my journey, I've traveled 23 years as a medical doctor here. So there are times you find that there's no medicine. There's a test that you could have done, an intervention that you could have done, and this is something that happens throughout the journey of each and every medical doctor.
How bad is the situation? How many cases do you maybe experience of such nature?
No, it varies, because sometimes you might find that maybe the machine, the CT scan is not working, and we've got patients whom we would want to scan. You find that there's a test in the lab, maybe the reagents are not there. You find that there's some tests, some patients where you wanted to give a medicine, the drug is not there, you know. Yeah, so these things happen time and again.
So considering what you're explaining here, how frustrated are you?
Okay, so first of all, I would say we, as doctors, nurses, we get very much attached to our patients. And what we would want, I think everyone wants an outcome that is good. And when the outcome is not good, no, I don't think anybody will be happy. So for us, there are several times we are frustrated when we know we could have done this, and you find that what you wanted has not happened.
Are there solutions to such problems?
Okay, as I've said, that the demand for our services outweigh our ability to provide the same. So there is a gap. A gap which is there is more financial, where, as you can see, this facility of ours is a facility which is saved by government. It's a government which is funding it, but the funding is not enough. So there have been one initiatives to try to have alternative financing. For example, to do a paying service, which will bring in some money, and that money would support the services. But when you look at that, again, there are also challenges. So that's why we're saying that some of us were saying that people have to contribute for services. So that we get more resources. We get more resources to finance the gaps that we have. More services, to be able to employ more people, to be able to be doing diagnostics, to be able to buy the drugs.
But you usually have your budgets every year that you do submit to
government.
No,
the budgets are not enough. The budgets are not enough, and they will never be enough, because it is the national cake which is cut and divided to everybody. So if you look at the country, it's not only health. There are also several sectors in the and when we say health, issues of health only don't belong to Ministry of Health. You understand? For example, when there is hunger, people get sick, they'll come here. The water is not good. Some people get sick. The roads are not good. You have got road traffic accident. Like now, the problem of the roads regulation, they're coming here. And then, for example, ignorance. We say ignorance is disease. If people don't go to school, they're ignorant. They get sick. They end up
You have just mentioned a very important
Yes.
point, Dr. Ngoma, about hunger. Are you experiencing such now?
Sometimes you find people, they're very sick, very, very sick. You investigate, you don't find any problem. You keep them in the hospital, you feed them 2 to 3 days, 4 days, 5 days. Okay.
Okay.
Right? And for information, the problem that happens here a lot, most of the patients are wasted. Right? So the wait for height is less, the majority of people. That's the commonest malnutrition that we have, wasting. Right? So it's more like an acute, something that is happening within a short time. But that which happens over a long time, stunting. Right? So height for age. So all those they are issues.
There was an issue that was hot in Parliament, the issue of healthy financing. Do you think it is a high time as a country people start paying in government hospitals?
It's long overdue. It's long overdue because, you know, everyone needs good care. Everyone. I don't think there's anyone who doesn't need good care. The question now is who pays? Because the problem that we have here is like in the hospitals, because when we're looking at the health system, I'm not just supposed to look at Kamuzu Hospital. I'm supposed to look at the grassroots level. You go to a health center, they don't have a BP machine. They don't have a thermometer. They don't have basic drugs. They don't have, because the so-called investigations to check if somebody has low hemoglobin, has the group sugar, diabetes, has malaria. It's supposed to be done at the health center. So we would want a health center because the more this is done at the lower level, the less work happening at the district and central hospital. So all in all, what we're saying is we need as soon as possible to be able to
maybe considering the districts that you are covering, like here you are saying you're covering 9 districts, and there are some people who come from deep in the rural areas. Do you think those people will be able to pay for the services that they get here?
Yes.
That is done.
So what we're saying is, when, I don't know you, but my colleagues there, when we were starting primary school in those days, we're paying 350, which I know where it went, it had an impact. We're almost 20 million people in Malawi. If each and every one of us contributes 1,000 kwacha, that is 20 billion kwacha. But you and me, should we contribute 1,000? Yeah? And you see for yourselves, when there's fuel scarcity, those people, their cars, you can see the lines. Right? Do you think those people deserve free services? Right? Right? And 2, what we're saying is we would want to increase the services that we provide. Because what we're saying is we want to increase the range. But what we want is we want patients not to go out of Malawi. We would love as much as possible that everything should be done here. But the question is, yes, we want to be doing everything here. Who is going to finance that? For example, for now, we're constructing the cancer bunkers there. The question now is, yes, those cancer bunkers will be constructed. What will be the running costs? Where will that come from? Now we have got initiatives where we want to start operating the heart. Would want to do that. For example, for us, KCH, we're working with the University of North Carolina. They will be coming next year to operate. There's a team that is coming this month just to see and to teach us. We have already started the program of teaching. We would want as much as possible. We want by the time I'm leaving the system, we should be able to do those things. But the question is, where are we going to get the money? Right? Who is going to pay for us? I think that's the message, and this is the debate that we need to.
So, in short, you are for that?
Yes, yes.
Maybe,
and I will be very happy to be the ambassador for it.
What do you think might be the reason why people do pass the healthy centers and come straight here to the referral hospital?
Yes, because there are no services. The services are not there. So if you critically look at the budgets these districts are given, it's not even enough to be able to provide the basics. That's why, for example, every day, the district hospitals come to beg things here. They come to beg things. Nchinji today came to beg things today. Rilongo DHO comes almost every day. But the issue is we would want them to be having those things. So in essence, what is happening is the budgets that have been given to the districts are not enough. That's the reason why the districts have exhausted their budgets. I would want you people to analyze the budgets. For example, I've said Rilongo as a district has a catchment greater than the northern region. Does Rilongo district get a budget bigger than the rest of the northern region districts? That's the question that I would ask.
So you are suggesting that government should consider increasing the budgets for such
no. So basically, what we need to appreciate is that our government is very laughing. The only thing...
You think so?
Yes. The only thing is they don't have money. You know, it's like you as a parent, me as my parent. I would love my children to have everything. Right? But it's more like you are looking at the countries, rich parents and whatever. So our government is a poor parent. Right? This is a government, you know, it is within the region. We're the only government which provides free services. Right? Which in essence shows you the love that the government has for its people.
Don't you think as parents they have a responsibility to make sure that they find better resources for
the issue is,
their children?
The issue is, if it's the same thing you're talking about a poor person. Right? You know, they say if wishes were horses, beggars would ride. Right? Malawi would love if it was like America. Right? Would love if we're like Russia. But we're not, and we cannot be. Right? We have over-relied on donors who also have got their own problems. Right? And you know, it's very funny to find that America, for example, supports us in health. But to find the people in America, they don't have access to health care. What hypocrisy is that?
Well, on the issue of healthy financing, recently you did revise the bypass fee for Kamuzu Central Hospital. Why did you do that? Okay,
so basically the reason why we wanted to raise the bypass fee was to data people, to make people not just come here. Because the bypass fee that was there, people felt it's nothing. So they would just, we tell them, they just pay. Right? Because but at the end of the day, as I've said, the staff were very overwhelmed. So they're overwhelmed with the flu, Chimfine. Right? When in actual fact, my staff should not be bothering with Zimfine. Zimfine should be managed at the health center. So in essence, that's
is it helping?
The what? No, we found, because we had to debate again, we did not implement it. So now, what we're saying now is we are not interested in the bypass fees. What we do is we expect everyone to come with a referral letter. Who doesn't have a referral letter is sent back.
I have noticed that some of the services here at Kamuzu Central Hospital are outsourced, like cleaning, security. How are these making medical personnel fully devoted to patients here? Okay, so first of all, it's usually very good to concentrate on your services. The ones which are not fully, your services should be devolved. But we decided to outsource cleaning and security because of the behaviors of our staff these days. With this democracy, you cannot discipline staff such that if we had not outsourced this place, it would not have been the way you are looking at it. Because they're working for government.
No, they're not working for government. They're working for, it's a private person. Yeah,
But
but
I mean, you can't discipline your staff
yeah, we
because
can't.
maybe they are working for government.
They're working
and
for
they do
government.
whatever they want
Right?
to do.
They can do whatever they want. Most of them have got their relatives at Capitol Hill. They're employed by their relatives, and you cannot do them. You cannot discipline them. That's what was one of the issues. Said, I think let somebody else do this, and those people are doing well. I think you can see out there. You see the hospital is clean and all that.
We have seen situations, sometimes people have claimed situations where bodies are brought down manually from upstairs. What are the challenges that are causing this?
Okay, so I think it's usually the issue of the lift. Yeah, so I think we've got a lift, and the problem that we have had as a country is because of the economics of scale, where maybe it's only one lift here. How many lifts are here in Lilongwe, for example? How many lifts? How many lifts? Not even more than 10. Yes.
Yeah,
which
exactly.
means you cannot have expertise to maintain the lifts.
Are you sure?
Yes. And because the more the more more equipment that is there, the more these people have got the expertise. The same as with the CT scans, it's only one. The competent people who can maintain them are not based in Malawi. But plus also the spare parts. Right? So one is the spare parts, two, the expertise. For information, the provider was here actually failed to maintain the lifts. 3 weeks. Then we had to look for someone. Right? And most of these people were very good experts in maintaining the lifts as Zimbabweans. Right? They're the ones who actually came and fitted the lift. And one of the lifts...
Zimbabweans, not Malawians. Yeah, no,
I'm just... Yes, because they have got experience. You know, that a lot of tall houses in Harare. Which means the expertise. You know, it's like every work, the more you do it, right, the more you know it. Right? Rather than having that machine, that lift, you wait for it to break down. Right? The only fault would be the one that you see there. But if there are so many of them, today this one has broken down, you see the problem. It's the same story here. Our doctors are very good. Why are they very good? They see a lot of patients, a lot of conditions. So it's the same story with medical equipment. Whether it's the lab, we don't have enough capacity to maintain machines. We don't have the CT scan there. We had an issue of dialysis, the dialysis that we had here.
So the issue is not finances?
No, it's not
you
finances.
As a hospital?
It's not finances. It's not finances.
When you have such scenarios, who bring those bodies down?
We get
and
people,
you pay them?
laborers come. There are a lot of people looking for jobs. Some of them come from the market there. Some of them are even guardians. We pay them. We pay them.
All right. I wanted also to understand from you, do you have cases of children in admission or adults who you think they do require specialist treatment elsewhere from here, from Kamuzu Central Hospital?
I've said that what we want is super specialist services to be done here. Yes.
But do you have such cases?
There are a lot of patients, yeah. There are a lot of patients.
So how do you handle such cases?
So most of those patients, we have an external referral committee here, which sit down. So the specialist who has seen the patient recommends an external referral. Then the external referral committee sits down, recommends, minutes are written, then they're sent to the external referral desk at the Ministry of Health. So now it becomes the issue with the Ministry of Health to refer them. But the external referral budget is very minimal. Yeah.
How transparent is the process? We have heard of cases where maybe some people who are connected to government
I think that is beyond
receiving...
that is beyond my jurisdiction. My jurisdiction ends where I have recommended and sent my request. My job ends there.
As the director, have you never ever received such complaint, maybe from any patient who was on the list?
How would I receive when my job is just to recommend? I just comment and send it to MOH.
Let me-
MOH will be better placed to answer that.
Let me take you back to 2021 when
Yes.
COVID-19 hit the most. What
Yes.
was the situation like here, Dr. Ngoma?
In terms of what?
In terms of service provision?
Okay, so COVID-19, we prepared it very well. We prepared it very well. The first wave was very short. When the second wave came, it started as if it was mild, December 2021. 2021, there were few cases. We thought who were on the beds for a very long time. So this is just a mild. But when cases started coming out, you remember the famous when we lost 2 cabinet ministers.
Yes.
And then there was a problem of gas. We asked the Malawians. We appealed to Malawians. I appealed to Malawians. I'm in a disaster. Can you please people help with gas? Malawians came in. Malawians mobilized resources. And we had no problems with gas. And that's the reason why I'm also convinced that Malawians will come to support the health system. We'll come together, we'll put money in there. You know, even in the village or in the family, when you want to do something, the others who are able to do it, they even contribute more than others. And basically, that's the system. Even the time we had COVID with gases, somebody bought gases worth 12 million, a person who didn't want it to be named. Brought it. So I'm of the conviction that Malawians can do better for their health. And we did that during COVID. Right? And whatever we're having as a system, the health, is also like a crisis where we don't have resources. But Malawians have got resources. Right? And when you look at it, you find that there are a lot of people whom we would not say they're officially employed, but they make a lot of money.
Was that your first time, Dr. Ngoma, in your career to handle such a big pandemic?
Yes, it's the first time. Because the other one happened 100 years ago. I was not there. The Spanish flu was not there. And now this one.
So this was big to you.
It's big. And actually, our emotions were tested. Because, you know, during the COVID-19, what was happening now is we were not sure what is going to happen. And then we were worried that the people that were going to put in the treatment unit, suppose they die. What is going to happen? What will be the reaction from the families? So, and we by God's grace, everything went well.
So what was going on in your mind when you see people coming in every day, at every hour, coming in, being your first time to handle such a big pandemic?
So it was very stressful. Because first of all, how stressful was that even you yourself, you were afraid that am I not going to catch COVID? And now what was happening was
and die.
Yes, there was nowhere where these people would go. So they are going to come here. So to us, you know, for us as a hospital, we made a policy that we're not going to test each other COVID.
Oh.
Yes, because we said if we're going to test each other COVID, we're going to close the hospital. For example, I'm with you today. Then tomorrow here and go married to COVID. What would you? Yeah, then it will be a chain. It will be a chain. So we said no testing of COVID. Whoever has symptoms should be tested.
Only those with symptoms.
Yes, because we divided ourselves into two. Half of the group was working, half 1 week, the other week the other one goes home, so that we prevented it. So it was the worst times for us as health workers. We're afraid, but the issue now is what do you do? Because these people are coming to you, they're coming to us.
So maybe what was the level of dedication from the medical personnel during this time?
Okay, so the dedication all the time is very good, and then when you go to the COVID unit, there was money, of course, because because now it's a debate. It's debatable. Was it that they were going there wholeheartedly, or they were going there for
For money.
for money? I'm not there to answer
judge.
us. Yes, I'm not there to judge.
But they were dedicated.
They dedicated themselves. They dedicated themselves. They supported a lot of people. They assisted, and I think it was during the second wave where I know that we lost a lot of people because of lack of oxygen. Yes, the oxygen was not enough, and the people were too many. You know, there were some patients where they would even need 2 cylinders, but there was no luxury of one having 2 cylinders.
Cool.
Yeah.
Maybe looking at that time, you were always around here,
Yes.
helping people, looking at what are we going to do next with this situation, where are we going to get this. Do you feel appreciated?
Yes, we very much. We feel very much appreciated. Society appreciated us. Even the government came to award some awards to members of staff, and the respect that our team has from the people. I think that's the most important thing. The appreciation that is given, a thank you that has been given by the patients. No amount of remuneration will thank you as much as possible.
What do you think are the lessons that the medical fraternity learned from that COVID-19?
Okay, so first of all, the first lesson that we learned is that we need to have a health system which is self-contained, which can do everything, because you know the airports were closed. These patients that were saying should be referred for super specialty services, they couldn't go. So the first lesson that we learned is we need to have a health system which is self-contained. That's the reason why we're trying to work to see how best can we have everything done at home. In issue of infrastructure, for example, oxygen plants, would want facilities to have oxygen plants, but also we need also to have purposely built infectious disease hospital. Infectious diseases hospitals to be properly built, and always we have to be vigilant.
Do you see that there is a political will?
Yes, there is.
To have such?
There is political will to do that, because there are plans to construct an infectious disease hospital here. Zomba already has an infectious disease hospital which has been constructed, but also there's political will to make sure that we have super specialist services. Like we are seeing now, there has been a camp which has happened at the Blunt Adventist. We're working together, government.
Is it really coming from your heart? I know you, that you
Yes.
are a very open-minded person.
It's coming
is this really coming from your heart, that there is political will?
It's really coming from my heart, because I'm also part of the senior management at the Ministry of Health. So we it's coming in, and also you look at, we have been having the German Malawi dialogue, where all these things came up to make sure that our system is strengthened. Yeah.
Maybe what is your reaction or your comment at the pace at which maybe the hospital is working on the cancer center?
Okay, so the construction that is happening at the cancer center is basically coordinated by the Ministry of Health. And so far, so good now. It's like there's a lot of progress, where we should be able to finish the bunkers, and we should be able to provide radiotherapy to our patients.
Do you think that the delays, maybe to have it completed, has affected in any other way?
Yes, because already there are a lot of patients who needed radiotherapy. There are a lot of patients who are dying. It's very few people who can be referred outside. So we needed this unity yesterday. Yeah.
Maybe how many people do need such services?
So it's usually patients with cancers is usually 1% of the population. 1% of the population.
All right. As we get down to our conversation, Dr. Ngoma, there is always a bad day for everyone.
Yes.
at work.
Yes.
Yeah. So how often do you have cases of mishandling of patients by professionals here?
So these things happen time and again, where because most of the department where we usually get a lot of these problems is Obs and Kaina, maternity, is where there are a lot of things happening. Maybe they have operated on, they have left gauze in the abdomen. I think you've heard about that. They have operated on a patient, and sometimes you hear a doctor was drunk. You hear a patient bleeding to death. You hear a nurse is called to see a patient, they don't go there, and the complications happen to the patient. So these things happen, they happen time and again.
So how do you handle such cases as a director?
Okay, so most of these cases, they're usually reported to medical council. Medical council, nurses council, who usually have the final say on the regulated aspect of it.
Do you have time to move around and see whatever is happening at this hospital on a daily basis?
Yes, so the beauty with me is like as a practicing clinician, I move around where I can be called for consultations in obs and gynae, in surgery, in peds, and in the department. So it's more like most of the times you do management by walking around. It's like you're going for something there, but as you are moving, you are seeing what is going on. Yeah, so we usually move around, but also we've got heads of department who see what happens. If there are issues in their departments, they tell you. They're also chief nursing officers for the departments. If there are things, they usually tell you. And also, we believe that as a hospital director, basically your job is to support the others. Your job is to facilitate what is happening, and basically not to be a policeman. Yet, because now if you do much policing, the people want to give them a lot, but also you believe that as a leader, you are not the best, but you need to get the best out of everyone. So in essence, that's why you can see that we get what we see here.
There are some wards, especially in the maternity wards, when you go around, you do see that there are women coming from theater and then they are sleeping on a bed without mattress, without anything.
Yes.
Why is that the case?
Okay, so the problem that we have had with linen is that patients steal a lot of this. We've always been buying linen. Within a short time, the linen is not there. So with the shoestring budgets that we have.
But you have security personnel here. Are they not doing their job?
No, so they are human beings. They're human beings. And actually, the security personnel, where are they? They're just in several strategic places. And I don't think they would be able to search each and every bag of. So most of the times, most of these security people, they're always in the gate. They are looking for where you have drugs or not. Somebody would have taken a bed sheet and put in the
bags.
yes. So usually that's the big problem that we have.
All right, we have heard of cases of anesthetists abusing chemicals and getting maybe addicted in some cases. Do you have such cases here?
So you know, it's like the problem that you have is here are the people whom you expect to be responsible. You expect the people to look after your property. You expect, because now the problem that you notice in the institutions is if there's a theft, it's not from outside. It is from within. So the same story happens with these people who, in essence, they're supposed to use those drugs to help the patients. Some of them don't even use the drug. They would give the water to the patient instead of giving a drug. Right? Doing a procedure called under mayo. The patient will be feeling pain and crying when the person has taken the medicine. So this is a big problem where the issue of drugs and the like, it's there.
So partly you're admitting that most of these cases that are reported out there of drugs are being stolen in hospitals,
they're true.
They are from your medical personnel that are working in the hospital.
How can somebody come from Chelsea and steal in the ward, in the pharmacy?
So what are you doing as a hospital? Should we say that you are failing your job in terms of security?
So, security is, as I've said, that you expect the integrity of the people. Yeah? You know, definition of integrity is where, what is it that you do when some people are not looking at you? So security for a property is not just one person. Security for a property is not just the security people. It is us to be able to appreciate that these things are ours. This hospital is ours. So our ability to appreciate that and be able to make sure that we look after the things is the security of it. So if there are thefts, it is basically all of us who are here collectively who are failing, not just one individual.
Maybe before we conclude our interview, Dr. Ngoma,
Yes.
we just wanted to understand the situation now at KCH. We have heard of situations where the hospital doesn't have goals. Do you still have such
No.
cases here?
So basically now it's the issue of supply chain, because you find that now the suppliers, for example, they don't have anybody in town. You find that suppliers don't have insulin supply. So it is an issue of supply chain, not basically lack of resources. No. Yeah.
Are you affected in any other way with the issue of shortage of forex in the country in terms of?
Yes, because most of the suppliers are failing to bring the commodities into the.
So how are you handling the situation?
Well, how do we? So basically, what is happening? Number one is we're trying to write the banks. To write the banks, can you please provide forex to this one? Who is going to bring in commodities? That is also working.
Do you have adequate personnel staff to do the job that needs to be done here at KCH?
I would say no. That's the reason why we're saying we don't have enough staff. But the staff that we have are stretching themselves. Right? That's the reason why you find that the waiting list, the lists, people complaining that they're taking long to be operated on, to be taken to theater. Some of them are, one, the theaters themselves. We don't have enough anesthetists, for example. We need, because for you to operate, there's somebody who's supposed to make you sleep. Yeah, so the lack of that also affects the services.
So maybe what are the areas that you may need immediate help in your view?
Okay, so one, there's need to train more specialized health workers. For example, the surgeons. We need to train more anesthetists. We need to train more specialized nurses.
Don't you think we have a lot of nurses or professionals that are trained in this country?
Yes, some of them are not employed. Yes, we have them. They are not employed. Yes.
So maybe what can be your quick advice to the authorities or the Ministry of Health in terms of ensuring that there are enough medical
so basically what is
personnel
supposed to happen is like government is supposed to employ the health workers so that we deploy them in the hospital. So in essence, it's not just here, it's across the board. From the health centers, the districts, the central hospitals, there's shortage of staff.
Lastly, maybe Dr. Ngoma, you have been here at KCH for quite a lot of years.
Yes.
Maybe what would you wish government to do to ensure that you are providing best services here at KCH?
Okay, so
overall.
Yes, so my vision, the time I wanted to live in 9 years from now, right? I would want Kamuzu Hospital to be able to handle all the cases. I would want Kamuzu Hospital not to refer patients outside. That's basically what I want. I want infrastructure to support the super specialist services. I want human resource to do that. I want diagnostics, which should be able to do that. That's my wish.
Thank you so much, Dr. Ngoma, for giving us time to talk to you in this exclusive interview. Thank you very much.
Thank you.
That was Dr. Jonathan Ngoma, Hospital Director for Kamuzu Central Hospital. This is Leah Malikano. Until next time, goodbye.